Hi, Paul Griffin here, MARTA's Director of Infectious Diseases, with another update on COVID-19. Obviously, the biggest news in COVID-19 recently in this country has been the situation in Victoria, the spike or so-called second wave that we've seen, which is definitely concerning. Recently, we've seen the numbers plateau, which is definitely a small step in the right direction, but we're yet to really see them fall away despite all the intervention that's been applied, and hopefully that will come soon. The situation down there and also in New South Wales is a reminder that COVID-19 hasn't gone away, and if we don't keep up all the right interventions, it could certainly come back, even here in Queensland. Some questions I've been asked lately include why has the situation unfolded so quickly in Victoria? And this is a complex one to answer, and I think it shows that there's been multiple breaks in the chain that have allowed the situation to get to the extent that it has. I think there was obviously some issues with hotel quarantine, but ultimately what we need is for everybody in the community to keep doing the right things. Social distancing, hand hygiene, staying home when you're unwell and getting tested. And if these things don't happen, then case numbers will rise and we will need bigger interventions to try and get the situation under control. And that's certainly what we're seeing in Victoria. Hopefully that won't be the case here, but that does rely on everybody continuing to do the right thing. Another question I've been asked is, are we doing enough testing here in Queensland? And I think the answer at the moment is yes. We've had ready access to really reliable testing, and that's a huge part of our success so far. However, if we don't keep that up, if people don't keep getting tested, then we could miss some cases of COVID getting introduced into our community and lose control like the other states have. So it's really important, despite us being in the season where we'll see lots of colds and other viruses potentially, that if you have any symptoms, runny nose, sore throat, fevers, the most important thing to do, stay away from everybody else, get tested and stay in isolation while you wait for that result. I also continue to get asked a lot about the wearing of masks, and this is a difficult situation that has evolved over the recent weeks and months. The situation in Victoria, where really strict restrictions have not yet reduced the numbers sufficiently, means that the addition of masks to those restrictions is a logical choice. And really the use of masks is for when social distancing and the other interventions are difficult to maintain. But it's not a silver bullet. If we don't keep doing our hand hygiene, staying away from others, a mask won't replace those other things. So it might change here that we use masks at certain times, but I'd recommend people take the direction of their local public health authorities. If the time arises we need to, then certainly do that, but do it properly, wear the right mask for the right period of time, and don't forget to still try and stay away from other people and do your hand hygiene as much as you can. Locally here at the MARTA, I'd also like to take the opportunity to thank our community for how well they've upheld all the restrictions that have been applied. It has been a challenging time, we are aware of that, but we've applied some restrictions on visitors, for example, in line with the best public health advice at the time to make sure we keep COVID controlled here at the MARTA and to make sure we can keep providing the service that we do for the community. So if you're unwell and need to come in, it's a safe place to do that. If you have an appointment, it's a safe place to do that. But if you are unwell and need to be tested for COVID, we have ready access to testing here as well, so we can take care of that safely for you also.